Next topic for the afternoon is Speak Up for Health Worker Safety. And coming in to deliberate on this significant topic and share her perspectives is Ms. Triona Fortune, Director of Fortune Quality Accreditation Services, Ireland. Ms. Triona is a strategic and outcome-focused leader with over 25 years' experience in senior healthcare management. She works with governments and healthcare institutions, developing and implementing strategy, governance, and quality systems. She is a patient safety expert for WHO and leads the development of the patient safety friendly framework. An ISQA expert and surveyor and formerly Deputy CEO of ISQA, she is also the recipient of ISQA's Lifetime Achievement Award in 2017. And with great pleasure and honor, I now welcome Ms. Triona Fortune to deliver her talk. Over to you, ma'am.
Thank you, Madam Chairman, and thank you to CAHO and ASQA and ISQA for inviting me here today. I'm here today to talk a little bit on patient safety, but really my main reason is to talk more on the World Health Organization. I'm very privileged to be working with the World Health Organization really for most of my career, but specifically for the last 4 years since I left ISQA and set up my own organization. And that's brought me on to looking at HR standards, not just in the accreditation field. Thank you to my good friend, Professor Marikar, for showing us the HR and accreditation. And I'm delighted to see that MSQH are continuing on their ISQA journey and so successful. And it's lovely to see Kedar and Peter on here today, people I've worked with for a number of years. But I want to take a slightly different approach and look at the standards that the World Health Organization have now put in place, and indeed what it means for you as a healthcare worker. So now let me see what's happening here. Yeah, so a little bit about patient safety. You'll see there on the left, To Err is Human, the seminal document. It's hard to believe that it's actually 21 years since that was published. And that was a group of very eminent people in the US who looked at, it was mainly drug errors, and they saw that there was far too many adverse events in hospitals, far too much harm to patients, and indeed deaths of patients. And they set us a great target. They said in 1999 that within 5 years, 50% of adverse events should be, we should reduce by 50%. And they suggested that we do this by really 3 ways: a good reporting system, a no blame culture within our hospitals, and it was mainly acute hospitals at the time, and learning from our mistakes. So correlating the results and putting actions in place. But the paper there on the right was 20 years on. That was actually nearly 2 years ago now. Professor David Bates, a great friend of ISQA, did a lit review and said we really hadn't met the target of 50% at all. In fact, we hadn't even met a target of reducing by 20%. But what they did say was that we were certainly a long way down the line, and I'm going to have to read this because they said this progress could lead us from the Bronze Age of rudimentary tool development to a golden era of vast improvement in patient safety. And they said that the way we were going to do this, and it was interesting to see your video at the beginning of this session, was through IT, information technology, and that has improved so much. And I have to hold my hat off to all my colleagues in India, because India is certainly coming across as the leaders in the field of IT, especially in healthcare. So what did the World Health Organization do for this? We need to look at the policymakers. The World Health Organization is one of the biggest policymakers in patient safety, and indeed the ministers of health. and they got together in 2019 at the World Health Assembly, and they wanted us to focus on patient safety. They wanted the public, the professionals, everyone to focus on it. So they said we should have a patient safety day every year. And the first one in 19 was around the things I've just spoken about. But thankfully last year, the one they had was to speak up for health worker safety. And that's the title of my session here today. And like all the previous speakers, I could talk for a long time on this, but I only have 15 minutes. But I was delighted to see that they had focused on the importance of health worker safety. Now, I have to say, I think COVID absolutely focused our minds on how important our health workers are, especially at the front line, but how susceptible they are to safety incidences. And it's great to see that this year the focus is going to be on safe childbirth and safe neonatal care. So let's look a little bit more. Like I have been working with the World Health Organization for 4 years, but I would say that one of their challenges, one of their weaknesses is when they write guidelines, they absolutely write War and Peace. You'd have to read a book to try and get to the absolute core of what they're trying to say. But for the patient safety goals, they actually have them quite neat and quite focused on what they want us to do, whose responsibility is and when we have to do these. So last year they published 5 goals, and you might be surprised by some of them. I was surprised by the first one there, prevent sharp injuries. I would have thought that we were well advanced in that, but we're not actually. It's still an issue. The second one there, reduce work-related stress and burnout. The third one is all around PPE, as you can imagine in this age of COVID. The fourth one, zero tolerance to violence. And the fifth one, report and analyze serious events. Now, I'm not going to go through these slides, but these are really nice slides that the WHO have for each of those goals. They're all designed in the same way. As I said, they all tell us a little bit of research. They tell us what the actions are, our personal responsibility, what the administration and the management should do, some of the barriers, and some KPIs. And as I said, I was a little bit surprised to see this one still on the agenda. But you can see there, I'd like you to take particular notice of number E there, the steps in trying to prevent sharp injuries. And while in Ireland we have plentiful supply of needles, there are still some countries that don't have enough syringes and needles, and they have to reuse them, which is a shame, but it's a necessity. And there are still some of us resheathing our needles when we use them. So it's just to have maybe something like this up on the wall so your staff can just remind themselves of the good practices around. So let's move on to number 2, work burnout and stress. And I was delighted to see Captain Nair talk about nurses in India and all the challenges that she has. And I have to agree with her and say that there are plane loads of Indian nurses coming to Ireland, and I'm very grateful of them. Thank you for that, because they're absolutely excellent nurses, and you must take it as a compliment that we wouldn't be going to India for our nurses if they weren't so good. But unfortunately, it does take away the leaders in your space. But there is problems with related stress, especially to the frontline workers. And again, I'm just going to read out a recent study of the World Health Organization. And they said, especially in COVID, they found that 1 in 4 people reported depression, healthcare workers, and anxiety. 1 in 3 suffered insomnia. And these were all during the COVID because of the extra pressures that we're putting on people. So what I would say here is maybe look at number D there. And what I would say to you is be kind to yourself and be kind to your colleagues. Just like the Institute of Medicine said 21 years ago, there should be a no blame society in our hospitals. We should have a no blame ethos ourselves. You know, we're the greatest people to blame ourselves when something goes wrong, and it mightn't even be our fault. So what I'm saying is hold up your hands, be kind to each other, and be kind to yourselves. So again, I just encourage you to maybe look at this and read all of the detail. So the next one here is PPE. Now, I can't talk about personal protective equipment. I'm not experienced in it. I'm very glad that I'm not experienced. I'm not a frontline worker anymore. My heart does go out to people who have to down up every day and try and work in those horrendous circumstances. I know in some countries PPE isn't available as much as it should be. Again, I would say try and prioritize and be kind to each other and help each other out. But again, this is just a nice one pager about how to don it, how to doff it, how to get rid of it, the barriers to implementation, etc. And obviously the World Health Organization had to highlight this in COVID. And again, just another statistic, and I'm sure I'm running out of time, but while health workers represent less than 3% of the population in developed countries and less than 2% in lower middle income countries, 14% of them are having COVID-19. Now, this was a study that the WHO did last year, and they weren't sure if the healthcare workers were picking it up in the community or in hospitals. But definitely our healthcare workers are our warriors, as you said at the beginning of this series. And we need to try and protect them. And I really would like to take this opportunity to again thank them for all the work that they do. Violence. This is some of the work that I have been doing with the World Health Organization in the patient safety framework. And unfortunately, the incidence of violence and verbal abuse among healthcare workers from patients, from relatives is increasing. It may be that it's the reporting of it is increasing. But again, I would say to people, we don't have to put up with abuse in the workplace. We all understand that healthcare is a very traumatic place for patients, for relatives. They're very upset at times, they're very worried about their loved ones, but it's still no excuse to be shouting and screaming at workers. And again, the WHO have highlighted an alarming rise in the reports of verbal harassment, discrimination and physical violence among health workers in this time of COVID. And one of the things that they do say here is remember cultural differences and traditions. And this is something that I had to learn. I've been lucky in that I've worked in the Middle East a lot in a Muslim culture, which is not the way I was brought up. I'm Irish, I'm a Celt, I talk a lot, I talk too fast, I talk too much. And I like to touch people. I like to touch their arm. I like to hug. And I've had to learn that when I go into a Muslim society that this isn't acceptable. It doesn't mean that I'm abusing somebody. And I know that my Muslim friends and colleagues know this, but it's just something to be aware of, in that remember that there's all sorts of different cultures, religions and traditions around the world, and just be aware of that. This is the fifth one, and this is something that I can't emphasize enough. This is something that the Institute of Medicine, Lucian Leaf, Don Berg said 21 years ago. We need to report our safety related instances, and to report them, the management have to have a nice, user-friendly, probably information technology savvy reporting system. Our people need to feel that they're not going to be blamed, they're not going to be chastised if they report near misses. But please, management, correlate all of these reports and put action plans in place. And remember to feedback. If a healthcare worker is going to go to the time and the expense and maybe the emotional, capability, the emotional stress of actually filling in a reporting instant, admitting that they were to blame for something, please feed back to them, and please put counselling in place and maybe supportive training and education programs. So you'll be glad to know I'm coming towards the end. There's a lot of information on those slides, all available at WHO. I'm happy if anybody wants to email me at any stage. But to conclude, we matter, you matter. Please be kind to each other and kind to yourselves. And together we really can make a difference, especially in this era of COVID. And again, thank you, Madam Chairman. Thank you for inviting me here today. And thank you to ASQA, CAHO and ISQA. So with that, I will conclude.
Thank you, Ms. Triona Fortune, for the wonderful talk. So we'll take one short question. How do you motivate and keep up the morale of the healthcare workers and keep their focus on quality, especially during these pandemic times?
Yeah, I think that that's a great question, and it's one that we all have to deal with at the moment. There could be shortages. The staff are working long hours. I would say that debriefing communication sessions are really important. Professor Peter Lackman is a great man around huddles. And I think huddles are really, really important, especially in the clinical workplace. I used to use them a lot in emergency. So like, get together at the beginning of the day, know what your responsibilities are, know who your patients are, know who you can go to for a little bit of support, and keep having huddles throughout the day if you can. And if there is a major instance or even like a minor incident, debriefing sessions are so important. Training is really important for staff. All of these new technologies that are coming in place. Every day, I'm so delighted I've been invited to go back as a nurse vaccinator in Ireland. Every day there's changes in the vaccine regimes. You know, they're coming out with new research. Give this vaccine to over 60, give it to under 60. So try and support your workers with communication, with evidence-based guidelines, and with communication strategies, I think is the most important thing. And I can't say it enough, and I know Peter says this a lot, be kind to each other and be kind to yourself.
Thank you, Dr. Triona, Ms. Triona again, for sharing your experience. Thank you.